December 2019, the world was about to face a challenge unlike anything seen before. A microscopic adversary known as the novel coronavirus was about to rewrite the course of history.
So the mysterious new virus.
Coronavirus.
There are fears a rapidly spreading virus has reached Australia.
This is a rapidly emerging situation.
As this global phenomenon unfolded, its impact would be felt across continents, affecting millions of lives and reshaping the very fabric of our societies. It has affected more than 18 million people globally, with over 600,000 deaths. The World Health Organization, WHO, declared COVID-19 as a pandemic on 11th March 2020.
The biggest quarantine.
One patient tested positive for coronavirus.
COVID-19 can be characterized as a pandemic.
First death being reported now from Karnataka.
We declared a public health emergency.
Little did anyone know that a virus, later named COVID-19, would traverse borders with unprecedented speed, leaving behind a trail of sorrow, resilience, and the indomitable spirit of humanity. Our journey begins in West Africa, in the heart of the continent, where a nation known for its vibrant culture and warm hospitality was thrust into an unexpected tragedy. Ghana, a country that would become a microcosm of the global struggle against the invisible foe.
Hello Ghanaians, good evening. The Minister of Health has confirmed 2 cases of COVID-19. The cases were confirmed on the 12th of March, that is today, 2020. And the first cases to be reported in Ghana.
The tests were performed at the Noguchi Memorial Institute for Medical Research, University of Ghana. The 2 cases were people who returned to the country from Norway and Turkey, making them imported cases of COVID-19 in Ghana. These 2 cases began the first contact tracing process in Ghana. On 15th March at 10 p.m., President Nana Akufo-Addo banned all public gatherings, including conferences, workshops, funerals, festivals, political rallies, church activities, and other related events to reduce the spread of COVID-19 at a press briefing on the state of COVID-19. This is after 6 confirmed cases. The tragedy unfolded as families grappled with the harsh reality of a virus that spared no one, challenging the very foundations of the nation's healthcare system. Through the eyes of those directly impacted, we witness the human side of this global crisis. Personal stories of grief, perseverance, and the unyielding hope that emerged from the darkest days.
I was at work when the first case was recorded. It was scary because it was actually a guest who came in to tell us about it.
Well, I was in the newsroom. My general manager called me and says, we should get ready for a breaking story.
At the point we were thinking it was not going to affect Ghanaians. We had to change our way of life. Personally, I had chosen to do my researches in COVID or on COVID and how how the media covered the virus. So that was one thing I also look at.
I think that the very first thing we did was we didn't rush to put out the information. We were very hesitant. We had to cross many layers to make sure that the information we were putting out there was right. And we're very meticulous in our scripting as well, to introduce elements of doubt, for people to know that we are not very certain as to the information we are putting out there, but also because of the fluid nature of the situation, it could change. So if we're saying X is happening now, it could change in the next minute or next hour.
This was a disease that we didn't know much about. And they said, let's trust what the scientists are saying. And I think that was a very difficult thing to do.
I must admit that it was a very difficult situation because a lot of the times, as journalists, if you are not an expert in a certain area, you depend. Even if you want to run it by other experts, those in practice, those who are on the field. But you have a situation where the experts even couldn't agree on some of the issues because it was very new. And so we were all learning, as we went on.
The challenge was getting people to understand the magnitude of the situation. Ghana is a lower middle income country. A lot of people barely are able to earn their daily bread. They live what we call hand to mouth. So if for any reason you have to restrict movement of goods and services, movement of persons, tell trotros and taxis and commercial vehicles to park, tell people you can't even walk out of your house, tell people you can't go to the market, you cannot seek your daily bread. It had to be a matter of life and death. And that the challenge was trying to explain to people that in this instance, you are better off alive than saying I have to pursue my livelihood at all costs.
Whenever I get any question in relation to COVID-19 or the pandemic, that whole thing, I sometimes feel like crying because the experience I had during that time wasn't a good and a pleasant one. So let me take you back. Pre-COVID, event MCs, we were getting events back to back every Saturday, Sunday, even sometimes weekdays we were getting events. But when COVID-19 came, all these things had to stop because there were restrictions. We were not going out, we were not able to go out to go and work. And some of the weeks, I was already booked for events and I had to refund the money back to these people. It is not their fault that the event had to be cancelled. So COVID-19 wasn't really good to some of us, like the creatives.
Trotro drivers in there, omuntu cars. Even kwa bebe kroma e taxi, anase boat na obefa. Na any etumi ba adwuma de yempo to me ne yenso e ya afufuro bi because na dey da yensa kaskanti yenso ye ba ne e bedi dwa etumi to no ema ne bi kwacha afufuro. Ba omo de no omgufi a omo nya adwuma bia.
Personally, when it happened, I was pregnant. It was painful, but I understood the company because they also got hit and they just couldn't do anything about it. We had guests even coming in with COVID. Some people had to go back. Some people got sick in-house.
It got to a point that hotels were being used as holding centers, and it also affected the hospitality sector because some were complaining that when people find out that they were holding COVID patients here, they did not want to book to stay there. So the implication on the economy and so on and so forth was so severe.
Even calls coming from the house, leaving my 70-year-old mother in the house, she would calling and she would ask you if you are not resigning. She felt I should resign because she also felt I would die. And even when you wake up in the morning, the fear of you going to the hospital to work, in the midst of all this, it wasn't an easy thing.
And they na bebre ba kai no mbesi sope ansa na omaba. But yen ba yetimi di be 3 days ni enko ofie because of say kai no wo kwa na ebisa wo ye there. But edu police for bi a ni o bisa say ye kwan ye say vegetables ni ebe ya na o mama ye kwan na ya ba ya beton ade ma afofo enti na ye wo dwom atem bia ton ade.
Because I tested positive for it. I went with my doctor on a normal shift, and then when I closed, I go to the house. I thought I was even off the next day, so I thought I was going to the hospital. Only for me to get to the house, the doctor called in a few minutes to tell me that, hey, isolate so. What is wrong? I just tested positive, and the man we just saw together just died. So please isolate yourself. Gosh, I didn't even know who to talk to. I didn't even know who to discuss my stuff with. So I called. Even my friends, my colleagues at work. You call somebody and the person was narrating how she feels somebody will go through this and I mean stigmatization and all that, making you feel like she really cares, but at the end of the day, you call and she'll be like, hey, maybe in trouble you, so that kind of thing.
See, when a person comes out of the 2 weeks isolation, we don't go close to them, and it became a problem. Even after the lockdown, the restrictions were being lifted, and we went for we go for events, we put on those masks and stuff, and sometimes we hear the COVID-19.
I couldn't talk. I was sweating. I was the symptoms was different coming together. I'll say it was painful, but then I thought I was going to die. It got to a point where just mixing anything just to survive. Like you hear that the doctor says zinc, you go and buy zinc. Vitamins, you go and buy vitamins. Like we were just taking all the chances to make it.
Because even going to check to know that you have COVID-19 can even kill you. It's not even about getting the COVID-19. It's about knowing that you have COVID-19. It can even kill you.
So the uncertainty was the biggest problem. And you know, if you don't know, people get more afraid. Family members, isolation. You are there with your spouse and kids, the whole house, and someone will get, another person will not get. You eat the same food. At least you have the same genetic markers or almost the same markers. And you don't know what will make someone contract and another person will not. And then you have to isolate. You can spray all the gadgets and doorknobs and still someone will get it.
I worked every single day until I got infected with COVID myself. So it was very apparent to me right from the onstage, but then also as the times went by, I thought it became even more apparent that look, you are a frontliner.
Actually, social media was a source of misinformation on the virus to a lot of people.
That if there was a 0.0001% chance that there was a vaccine that some people were using that led to blood clotting, there was this spread of fear that no, the COVID will not kill you. It's even the vaccine that is coming to kill you.
When we started doing the Meet the Press at the Information Ministry, and you know, it was carried live on my channel, but also on GTV and many other channels, I had people sending me questions. That was the point where I realized that look, the whole of the nation, most importantly your contact and those who could get access to you, are really depending on you for information. And there were times when people didn't understand what the medical people were saying, and they looked up to you to break it down for them.
Collaboration with all leaders of congregations and chiefs and key stakeholders so that we can educate. Public education campaign. Here at the Ministry of Information, I know there were a lot of below the line campaigns with the Information Services Department and advocate for people to obey the safety protocols. And then the vaccination campaigns. By the grace of God, we are here.
In the aftermath, we found ourselves grappling with profound questions. What have we learned from this global ordeal?
Work from home is becoming a thing. It doesn't work for all industries, but let's try to meet each other halfway. The working environment in itself shouldn't be the same post-COVID. We should have a more fiscally healthy environment, mentally healthy environment. Health policies should change.
We should just love one another. We should help one another when we can, because the way it hits the country, the moment you hear that this person is gone, that person is gone, it was painful.
I'm excited that we've learned from the experience of the COVID-19 pandemic and we are building on it.
It may allow the lessons of COVID to just pass without us, implementing the change that we ought to, and making and preparing ourselves better. When the next pandemic happens, we'll be worse off. And I think that we must learn the lessons.
As we bid farewell to this chapter, let us carry forward the lessons learned, cherishing the bonds that held us together in our toughest times. Ghana, resilient and unwavering, looks ahead to a future filled with hope and unity. Thank you for witnessing this journey with us.